Hey guys, in this lesson, we're going to talk about the characteristics of sinus tachycardia and the most common symptoms, some of the possible causes, treatment, and nursing interventions. We're also going to break down each of the steps to learn how to identify it on an EKG. So in sinus tachycardia, the SA node initiates the electrical conduction just like in normal sinus rhythm. The only difference is that it is beating at a rate greater than 100 beats per minute. And because the SA node initiates that electrical impulse, it is called sinus tachycardia. So let's talk about the 6-step method to look at the characteristics and identify the rhythm on an EKG. Now, if you guys have not watched the normal sinus rhythm lesson, please make sure that you check that out because it breaks down each of the steps in more details and it will help you with abnormal rhythms. So let's go ahead and get started. Number one, we have got to look at our rhythm. Is it regular or is it irregular? So let's count the small boxes in between the R waves. So from here to here, we have about 13 boxes. And from here to here, we also have about 13. And from this one to this one, we have 13. So it's pretty consistent. So our rhythm is a regular rhythm. In step number 2, we're going to look at the heart rate. So we got to determine that we have a 6-second strip. So we would have 30 large boxes in the entire strip. And then we're going to count our R waves. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So 11 times 10 gives us 110 beats per minute. But let's do the 1500 method as well. So we're going to divide 1500 divided by 13. And we're going to come up with 115 beats per minute. And don't forget that this method is just more accurate. So our heart rate is anywhere from 110 to 115 beats per minute. Now let's do step 3. In step 3, we need to look at the P to QRS ratio. Do we have one P wave followed by a QRS in every complex? And we do. So every P wave has a QRS behind it. So our P to QRS ratio is 1:1. Now in step 4, let's look at the PR interval. And so let's go ahead and pick this one right over here. We're going to start at the beginning of the P wave to the beginning of the Q wave. And that would be 1, 2, 3, 4, 5. So that gives us 0.20 seconds. And that would be within the normal range. And in step 5, we're going to look at the QRS complex. So let's go ahead and pick this one right here. So from here, the beginning of the Q wave to the end of the S wave, we have 2 boxes. And that would be 0.08 seconds, which is also within the normal parameters. And so step 6 would be to identify our rhythm, which would be sinus tachycardia. So let's recap these characteristics. Our rhythm is a regular rhythm. Our heart rate is 110 to 115 beats per minute. Our P to QRS ratio is 1:1. Our PR interval is normal. Our QRS complex is normal. So our rhythm is sinus tachycardia. But because it is an abnormal rhythm, we have to find out what is going on with our patients that is causing them to be tachycardic. Okay, so when you have a patient with sinus tachycardia, the first thing that you need to do is assess them. Find out their presentation, find out their signs and symptoms. Are they stable or are they unstable? Sometimes patients who are stable and are tachycardic, they may still have some signs and symptoms. However, if they are unstable, they will report having a rapid heartbeat, palpitations, and lightheadedness. They will also have a decreased cardiac output, which will cause them to have shortness of breath, chest pain, and hypotension. So let's look at our heart. Our heart is responsible for sending blood to the brain, to the lungs, to the body, and to the heart itself. So when the heart is contracting really, really, really fast, it does not have enough time to fill up with blood. So if it does not have enough time to fill up with blood, the stroke volume is going to be decreased. And the stroke volume is the amount of blood that's ejected with each contraction. So normally it's about 75 mils. So when the heart does not have time to fill up with blood, the stroke volume decreases. So let's say it's about 50 mils. And this causes the cardiac output to decrease. And this is why people complain of shortness of breath or chest pain or hypotension and the lightheadedness. So after you determine the patient's signs and symptoms, you gotta find out the causes. Why are they tachycardic? If you can find out why they are tachycardic, it is so much easier to treat them. So these are some of the common causes. Fever. Fever increases the metabolic demands, which is why people become tachycardic. Dehydration, hypotension, and anemia. What this does is it decreases the blood volume in the circulatory system. So because of that, the heart will compensate and it increases so that it can increase the cardiac output. Anxiety and fear. Do you remember that good old fight or flight? Well, when that kicks in because of anxiety and fear, it just increases the heart rate. And pain. Pain increases all vital signs, but specifically tachycardia. So if you ever have a patient who's complaining of acute pain and they report that it's 10 out of 10 and their heart rate is in the 120s, treat the pain first. Once you treat the pain and their pain level goes down, their heart rate will start decreasing. So now that we talked about the signs and symptoms and causes, let's talk about how to treat these patients. So therapeutic management for tachycardia. Most important thing you got to do is determine the cause. Again, if you can find out why they are tachycardic, you can treat that, and then the tachycardia will improve. Find out if they are stable or unstable. If they are stable, great, continue to monitor them. Now, if they become unstable or if their heart rate increases a little bit to 120s to 130s, try to do a vagal maneuver. And this is where you ask the patient to bear down, kind of like they're having a bowel movement. That's going to stimulate the vagus nerve, and hopefully their heart rate will go down. If that doesn't work, we can always try beta blockers and calcium channel blockers. Or we follow the ACLS guidelines and give our patients adenosine. Usually we would start out with 6 milligrams of adenosine. And what this does is it tremendously slows down the heart rate or stops it completely. So when it starts back up again, it tries to start it at a normal rate of about 60 to 100. Now, if one dose of adenosine doesn't work, then we do it again. And the second time we do 12 milligrams. So hopefully the second dose will work. If not, or if our patient is unstable, then we got to do a synchronized cardioversion. So let's talk about a synchronized cardioversion, because a lot of people get those confused. So here's our patient. And he's sad because he's unstable. So let's say his heart rate is in the 140s and he's very unstable and symptomatic. I'm going to apply some defib pads, one on the back and one on the front. Connect them to my defibrillator. And I'm going to push the button that says sync mode. So what that does is it tries to synchronize with the patient's R waves. So I will see a little heart pop up on the EKG monitor. And so when this happens, when it has synced with the R waves, it's going to deliver the electrical shock after the patient has repolarized. So it'll try to deliver the shock right here. And it does this to prevent the patient from going into VFib. But we'll talk about VFib in another lesson. For right now, just understand that that's all synchronized cardioversion means. It syncs with the R waves to deliver the shock after repolarization has occurred. So the main key points to take away from this lesson are the main characteristics of sinus tachycardia. They are the same as normal sinus rhythm. However, the only abnormality is that the heart rate is greater than 100 beats per minute. Make sure that you always assess your patient first. Find out, are they stable or unstable? And determine the cause. If you know why they are tachycardic, it is so much easier to treat them, and you know how to treat them. And always follow the ACLS guidelines. Adenosine, start with adenosine, 6 milligrams the first dose. If that doesn't work, then give them 12 milligrams. If they are unstable, then we got to do a synchronized cardioversion. So I hope that you guys have enjoyed this lesson and feel more comfortable with being able to identify sinus tachycardia on an EKG, and that you know what nursing interventions to implement when you see this rhythm. Make sure that you guys check out all of the resources that are attached to this lesson so that you can keep practicing and becoming more familiar with sinus tachycardia. Now make sure that you guys go out and be your best selves today. And as always, happy nursing.